and you yourself came from Civvy Street. In your view, are there enough people in the civil, normal public to support people who've been traumatised in that way?
It depends where you are in the country, and it very much is almost that, dare I say it, postcode lottery. If you're close to a major trauma centre, you'll probably there are a number of people who have very, very good skills. If you're out in a more remote area, you've probably got people with more limited skills, purely because there are probably less people they're going to come across who actually have the injuries. What we have discussed with the Charter Society of Physiotherapy, and the Chief Exec of the Charter Society of Physiotherapy is very important, is very interested in getting the leadership going within the therapy side of things. Is that we will quite happily act as mentors for people in remote areas, for therapists in remote areas who maybe have not yet got the skills, but we could maybe upskill them in order for them to support someone closer to their home. So we're quite happy to do that, and I've talked to the Charter Society of Physiotherapy. We're quite happy to talk to other therapists, and that, I think most of my colleagues in other professions would do that as well.
As soon as someone's gone through a major injury, you do the initial rehabilitation program, but then it's very much put out into the big wide world and having to fend for themselves in many instances. Not all the cases, but in many instances.
Well, we try to give them the skills and the confidence to go out into leisure centres, and we work very closely with NERS, which is the National Exercise on Prescription for the relevant patients. But we've withdrawn our support, the intensity of our support at that time. We're still available if they need us to pop back in, but we can't do certainly the intensity that they can do at Headley Court, unfortunately.
And I think we're all interested, Sandra, in the observation you made about how they manage to inspire each other to recover quicker. And I guess perhaps in our normal sort of leisure centres, people are a little bit, what's the word I'm looking for? Cautious, intimidated by the general population, the general public in there, that they're perhaps not working in groups and individuals. But if we could get a centre where they're all working together, they can relate to each other's injuries and challenges, that's going to bring them on that much quicker.
I met up with one of our ex-patients who left the army a few weeks ago, and he was telling me that he'd actually put an awful lot of weight on, and he suddenly had a wake-up call and went, right, I know what I need to do because I've been given the skills to do it. He then took those skills and went and picked himself up, started exercising again, lost the weight, got back on his prosthetics because he hadn't really been wearing them that much. And I think that's part of it. As long as it's not only having centres for having people working, but it's having somewhere where they develop those skills that they can use again in their life. The NHS does that incredibly well.
A guy who had a spinal injury, and he lived in Kent and drove all the way around the M25, and it took him almost 2 hours. And I thought he was back for an outpatient appointment, and he said, no, I'm back working out here. And I said, but I sent you away to all these other facilities. He said, Brian, I went there, they had accessible equipment. He said, but the attitude of the staff was diabolical. You know, I had people like, just thinking that he was an obstacle that was getting in their way whilst they were trying to use other equipment in the gym. He said, I'd rather spend lose half of my life driving around the M25 to come to you, so I can be in an environment where when I park my car, I actually leave my disability in the car park. As soon as I'm in your building, I'm just a customer. I'm just a guy having a workout, and that's why he comes. Other people who come to us, it's because there is nothing else like it in the UK. One thing I normally claim is that we are possibly the most accessible and inclusive leisure facility in the world, and I've not found another facility that can match it. One thing I didn't do is give you any performance stats. We've got 500,000 active visits a year. 36% of that is by disabled customers. 27% of our membership is taken out by disabled customers. And that's totally disproportionate. I wish we had less disabled customers coming to our facility because they could go to other facilities that were more accessible. The last point to answer is that we have equipment that you wouldn't find in these standard facilities, such as the functional electrical stimulation cycle that we have. It's £15,000 worth of kit. Any other leisure operator will be saying, how many people are going to use it? When do I get my return on my investment? I could buy 4 treadmills for that. How many customers can I cram on those treadmills per hour throughout the day? You know, that's how they work. They're not thinking about the massive benefit to customers.
Why hasn't anyone emulated Aspire before now? Because when we came to see the facility up there with you, the first thing we said on our first visit was, you've read our script. Because you were providing exactly what we put together in the first instance. So why has nobody copied this up until now when we had Treater trying to do it?
Why has no one else done it? It's not an attractive offer. I hate to tell you this, but because I have so many friends and contacts still in the leisure industry, and we work to get our instructability graduates to undertake a work placement. I won't tell you the name of the company, but the guy who went to give a presentation to his board, and it was a private chain, apparently the operations director said, you want to do what? You want to put disabled people on the staff in our clubs? Are you mad? See, absolutely no way. That is never going to happen whilst I'm on the board of this company. I do not want disabled people putting my customers off. They won't fit. It's not happening. So that's why the private sector never does it. Public sector, because I just think they haven't woken up yet to the reality that, you know, we're talking about people in our society who could best benefit from it. It's a shame.
I'm a patient, and I've also a founder of a rare disease charity in Wales. A comment to the lady over there as well. I live in Carmarthen in West Wales. As far as I know, there's no accessible gym in Healthward in that area, and they've also admitted there's no hydrotherapy service. So Treat Trust would be in an ideal position to, you know, facilitate their services.
My background is pressure ulcers, and I see all walks of life, not just the elderly, from 18 months up to 102. And very often what hopefully people do know is that pressure ulcers are mostly caused through immobility, reduced mobility and inactivity. So by allowing people to have access to facilities to help them increase their activity, increase their mobility, surely it's a no-brainer. You know, the NHS will be preventing the majority of pressure sores by allowing people to have the facilities and having that social group network and education side of things in order for them to look after themselves.
And just like with everything else, we are quite behind in terms of development of major trauma centre, and we are talking about a collaborative trauma centre between Cardiff and Swansea, and there will be a need for trauma rehabilitation as well. And this workshop was how we are going to actually deliver that rehabilitation to patients from Wales. So I think this is an excellent opportunity, and I can always give you contact details of the right people, and you need support from NHS and the Trauma Rehab Network for this project.
And it's not a case of one size fits all. I mean, we're very lucky, we have fantastic support in Bridgend. We refer into NERS, the National Exercise Scheme. We have a stroke-specific exercise class in our leisure centre. So we've built up huge partnerships. I think if you asked mine today, the 105 I work with today, what they would want more than anything that was lacking is the psychological support. Very few of the people that I work with had any psychological support after their stroke. And that's why the community groups that I run 3 a week, plus we have a shooting group, we have an allotment. That community, that cohesion that the groups present gives them a huge boost, confidence-wise, etc. And there is no doubt that because we see these people regularly, it stops inappropriate readmissions to hospital. 85% of the people I work with do not have a social worker, so we save the local authority an inordinate amount of money, and the third sector really is a very good, cheap option. So I think that rather than have lots of fragmented ideas and services, something like Treat could be bringing all this together. The lady over here made the point, there are services out there, and there are pockets of money being spent on these little services everywhere. We need to be more integrated. All this fragmentation has to stop, and we have to pull it all together to make sure that people have the very, very best, as opposed to a little bit of good and a little pocket of area. And I mean, you sum this up to me.
I think that's where actually the military has the advantage. We have a coordinated approach, and I think that's, and everyone who's working in the NHS, etc., will tell you that's some of the frustration. It's the cross-organisation fragmentation that you get.
Our policy and research officer is blind. He works in the same office as everyone else. Winnie, his guide dog, stinks. Honestly, the biggest issue we have in employing blind staff is wet dog. It's just horrible. He came in my office the other day, and apart from Winnie covered my suit in dog hair, I do actually have most staff have a sticky roller now in their desk, so they can get the dog. Like, you can walk around anything. We have blind people who will use the treadmill. There's a little safety clip you put on, so that if they start to drift backward on the treadmill, it actually disengages the power and the treadmill immediately slows down to prevent. But most of them turn up with a personal assistant. We have people who don't turn up with personal assistants, and they have guide dog, and they go and do the aqua class. But most leisure facilities would say, you are kidding, you are not taking a dog on poolside. Why not? You know, most people develop these attitudes for the wrong reasons. They find excuses not to, rather than, yeah, we can walk around that.